Former Health and Human Services Secretary Becerra is conducting a virtual event right now. It started about half hour ago, but we'll take this from the beginning and get you caught up. This is on health care cuts. We'll start you out here on WCNC Plus.
Recording this call to share it afterwards, and we'll be having Q&A at the end as well, and all this entire call will be on the record. With that, I will go ahead and pass it to former HHS Secretary Xavier Becerra.
Erica, thank you so much for inviting us to Defend America Action. Thank you for all the work that you're doing to exactly that, defend the American people and our policies and our principles that let us be the nation that leads the world on so many things, but certainly on healthcare. And so I'm pleased to be here as well as the former Secretary of Health and Human Services, joined by a colleague, Carol Johnson, who was instrumental in making sure that during COVID, Americans had a chance to recover and then flourish and thrive. And so I'm pleased to be here with then Administrator Johnson and certainly with our legislative leaders. Congressman Walkinshaw, congratulations on your victory. Look forward to working with you as you work in Congress, and to our delegates. You have work to do, obviously, in the great Commonwealth of Virginia. Look forward to working with all the delegates who are joining this call. Let me just say right off the bat, and I think Carol will validate this, that there is no place on earth like the Department of Health and Human Services when it comes to making sure that the health of people, the health of Americans, the health of people around the world is protected, and that we take every action possible to keep people not just alive, but thriving. The Department of Health and Human Services has some of the greatest talent, some of the greatest professionals, some of the greatest experience in dealing with crises. Unfortunately, when you don't use that talent, crises do develop. While we dealt with some of the biggest crises in the world during our term under President Biden, and we were able to not only recover, but come out on the better side of things, you know what needs to be done. And what we discovered is that if we are all working together, getting ready, preparing, then responding quickly, that we can tackle these crises that are naturally caused by disease, that are coming at us by viruses like COVID or Ebola or avian flu. The good thing is that we've got the talent to keep Americans safe and healthy and alive if you use them. And unfortunately, what we are finding that today, it's not the nature-caused crises that are infecting America's health. It's the man-made crises that are infecting America's health. Today, we've seen children die from measles because they were not vaccinated. Today, we're finding that with the growing spread of COVID today, that people are having a hard time getting the vaccine that they want to treat, to prevent COVID from hitting them. Today, we're finding that the generation of medicines that will be needed to deal with COVID's mutations, or with the next virus that might hit us, have now been asked, all those talented people, all that research has now been told to stand down, and that money is not being allowed to be used to do the research. The end result is that we're going to see man-made disasters coming our way unnecessarily. And it's unfortunate because at the same time that this administration has essentially closed down the talent, closed down all the experience that has made it possible for us to keep America safe, this administration is also gutting healthcare for so many families. When you take $1 trillion out of the Medicaid program and you tell people that they will no longer have access to that care, it's going to hurt a lot of people. And when you realize that the Medicaid program essentially helps nearly half of America's births be healthy, when you realize that some 60% of the cost of our loved ones, our seniors, our grandparents living in nursing homes is paid for through Medicaid, we're going to do a great deal of harm to a lot of Americans. And it's unfortunate because all that money, that $1 trillion healthcare system, is being used by Republicans to cover the cost of tax breaks for billionaires. So here you see the clear choice that we have: either protect our America's health or protect the wealth and shelter that of wealthy billionaires. And the choice was made by too many in Congress and this president to choose billionaires, at the same time that this administration is standing down the great tools that we have at the Department of Health and Human Services. It's a prescription for a man-made disaster. And we thank those who are fighting against that as we speak. And I know in this Commonwealth of Virginia, there are people who are championing the cause of healthcare for all Virginians. And I appreciate what they're doing, but we got to fight because we can see what's coming around the corner. It's not a natural disaster. It's a man-made disaster. And it's time for us to fight, not give up, and make sure we keep America healthy and strong for our kids into the future. So I'm pleased to join. Look forward to any questions. I'll turn it back over to you, Ro.
Secretary Becerra. And with that, we will go to former Health Resources and Services Administrator Carol Johnson.
Thank you, Ro, and the team for hosting today's call. And it's an honor to be back on a call with Secretary Becerra. We did much work together. I wish it was under better circumstances, but I appreciate the opportunity to see you and our legislative colleagues both in the Congress and in the House of Delegates. My name is Carol Johnson. I was the administrator of the Health Resources and Services Administration, the federal agency that's really charged with helping to expand access to health care in historically underserved communities, including rural areas. And it was our job to really lead that charge. As the secretary mentioned, our work and the folks who do that work, many of them Virginia residents, have been laid off or riffed in the last several months. There's been a 30% reduction in the staff at HRSA that was already lean and mean doing this critical work. And so as we go into this challenge when healthcare dollars are disappearing from communities across the country, the people, the experts who were there to help make sure that communities knew how to stretch the dollars they did have are no longer there as well either. I will start by talking a little bit about what's really happening on the ground and what's likely to happen on the ground. At HRSA, we were the home of the Federal Office of Rural Health Policy, and we were also the home of critical services delivered in rural and urban communities that are historically underserved, like federally qualified health centers, like Ryan White HIV care services, and investments in training the next generation of the healthcare workforce. So when Congress and the president in this administration took nearly $1 billion out of the Medicaid program and are now debating whether or not they're going to extend critical credits that make health insurance possible and affordable for small businesses, for kids aging off their parents' health insurance, for those older adults who are nearing Medicare retirement age. All of those folks are about to lose those enhanced tax credits that make their health insurance affordable. So when you take nearly $1 billion out of the Medicaid system and see a whole host of other people lose their insurance coverage from the marketplace, what you see is devastation for the healthcare provider community that depends on those resources to be able to sustain their services. And so you've seen the projections, right, of hundreds of rural hospitals at risk of closure. You will hear a lot about the $50 billion rural funds that Congress created as sort of a political solution to solving the problem of trying to get this bill passed. That application was released this morning. That is a Band-Aid. That is temporary money, only available for 5 years. And CMS made clear this morning, if you're not spending it fast enough in the way they want, they're going to come take it back from you. And then it's creating this huge cliff in 5 years, just as all of this $1 trillion worth of Medicaid cuts are ramping up. So the 10-year projection number that we've all seen for what's going to happen to rural hospitals is something like $140 billion in cuts. And so clearly this rural fund is not going to solve that problem. And we are going to see rural hospitals cut service lines, lay off staff, potentially close. We already see hospitals saying they're not going to do planned expansions. They're going to reevaluate service lines that they were otherwise intending to expand. And so, that means that less services are going to be available in rural communities. And that doesn't just impact people who receive Medicaid benefits. My older in-laws used to live in a rural community with a critical access hospital. If that critical access hospital closed, they were going to have to move. They probably couldn't have moved there to start with, because if there isn't healthcare services in the in the community, then the whole rural community suffers. And that rural hospital depends on Medicaid to make their business run. And the other thing that I think is a little bit overlooked in the short term here is as rural hospitals are quickly trying to evaluate how they're going to manage through this terrible funding challenge that they're facing, it's that much harder to recruit providers to come practice in rural communities. It was hard on a good day, but now you've got to go out and try to convince a new primary care provider, a new surgeon, a new ER doc, a new hospitalist to come practice in a community where your hospital is incredibly vulnerable to closure or to service line closure. And so the effects are happening now. While we hear people on the Hill saying, you know, maybe we'll have a chance to revisit some of this, maybe we could do some things before all these cuts kick in, that doesn't align with what's happening on the ground now, which is healthcare facilities and clinics are deciding today about how they're going to try their best to weather this storm, and maybe not, but do their best to try to hold on as long as possible in rural communities. And decisions are being made about what services are going to be provided based on that. I also will note, while there's been a lot of attention on rural hospitals, safety net hospitals in large urban areas are often your level 1 trauma center in your community. We all depend on those facilities for the acute care that's needed if someone's in a car crash, if there is some kind of other acute incident, and those facilities are incredibly dependent on Medicaid resources. Again, we're going to see a constriction of services and access because you cannot take $1 trillion, nearly $1 trillion out of the Medicaid program and think it's not going to impact every single one of us. So thank you to all of my colleagues on this call for lifting up and drawing attention to this moment and the challenge that this means for communities across Virginia and across the country. Back to you, Ro. Thank you.
Thank you, Administrator Johnson. And with that, we will go to very newly sworn in Representative James Walkinshaw from Virginia's 11th District.
Well, thank you, and thank you to Defend America Action. It's a great honor to be here with you all to talk about this very important topic. And I was Congressman Jerry Connolly's chief of staff for 11 years, starting in 2009. Congressman Becerra was there at the time, and we fought very, very hard to pass the Affordable Care Act to increase access to affordable health care across this country. And that's one of the reasons I am so outraged and disturbed at what has taken place in Washington and what's taken place now. You know, we are barreling toward a shutdown, a Trump shutdown later this month, in large part because Trump has instructed congressional Republicans not to negotiate with Democrats at all, not to work in a bipartisan way. And what we as House Democrats have been asking for is just a conversation, a negotiation about the American people's need to have access to high quality, affordable health care, a conversation and a negotiation about preventing the devastating cuts that are headed our way. And those are cuts that will have a very real and tangible impact here in the Commonwealth of Virginia. We have two great delegates here who I know are going to speak to that, but we know based on analysis from the Kaiser Family Foundation and the Congressional Budget Office that 300 to 350,000 Virginians are projected to lose their Medicaid coverage because of the cuts. Here in the 11th District in Northern Virginia, there are 68,000 individuals on Medicaid currently, about 9% of our population, which sometimes surprises folks because despite our relative affluence in Northern Virginia, there are still a lot of folks working very hard every day to make ends meet, and these cuts will hit them very, very hard. Of those 68,000, 37,000 are children, and 10,000 are seniors right here in the 11th District who are on Medicaid. We also know that, you know, the kind of other freight train that's coming at us are the cuts to ACA subsidies and the skyrocketing Affordable Care Act subsidies that we will see if Congress doesn't act. And in 2024, here in the 11th district, there were 36,000 people who were enrolled in ACA Marketplace health insurance coverage. That's an increase since 2020 by 4,100 people. So a lot of folks in our community have been benefiting by the increased ACA subsidies. And if Congress doesn't act, their premiums will go up by $1,770 just this year, a 68% increase just this year. So those cuts will be devastating to thousands of families in the community that I represent. We know that our health systems are ringing the alarm about that. Inova Health System, the largest health system here in Fairfax, has warned that.
You have been watching a virtual event from former Secretary of Health and Human Services Xavier Becerra. We're going to take a 2-minute break here.